Hello everyone, this is Dr. Sushma Sarilla, consultant doctor at Fidicus Homeopathy. Today we are going to deal a topic called as urticaria. So why are we dealing with urticaria today is that the reason 20% of the population or every 5 to 6 years the population suffering from urticaria is increasing by 20%. And not only that, there are two stages in urticaria, acute and chronic. Acute exacerbation of the chronic state or an acute state can sometimes be life threatening. So let's dive into the topic and know what are the causes, what are the treatment options. So what is urticaria? As you can see, urticaria is raised welts, red raised welts. For example, if you're having a mosquito bite, the reaction you will be getting on your hand, but that reaction is a little bit profound. The same thing you find in urticaria. Urticaria can be because of infection, it can be because of food allergies, or it can be because of any underlying systemic disease. So what are the signs and symptoms of urticaria? Urticaria presents with raised, in the sense a little raised from the above surface, raised red welts which are blanching. That is, if you put pressure on this welts or in this raised region, it will blanch or it will become pale. And also not only that, it presents with itching, intense itching. So what is urticaria? Urticaria is nothing but an allergic reaction to an allergen of any kind, where it presents with raised, itchy red welts or wheal-like presentation on your skin. It can present anywhere on your body. What are the investigations? Remember, though urticaria is just a skin manifestation, it can have its roots in the systemic parts as well. Like even if your liver or your kidney is affected, you can have or present with urticaria. So let's dive into the investigation topic where you will know in depth what is the cause of urticaria. Primary is clinical history, lab tests, allergic sensitivity tests, clinical suspicion tests, and skin biopsy. What is clinical history? See, not all kinds of urticaria need investigation. So, first, when a patient comes to us, what we need to do is take a proper history. So, what does the history include? It includes onset, like is it sudden or is it slowly developing? And then, what is the duration? Like, is it less than 6 weeks? If it is less than or equal to 6 weeks, we consider that as acute urticaria. If it is more than 6 weeks, then we consider that as chronic urticaria. And what is the pattern? Like, for example, are you suffering from top to bottom, or if you're suffering only in a certain area, like in your thighs or in your hands or in your face? It depicts what kind of urticaria it is. Then coming to exposure to allergens, what sort of allergic reaction you're having after exposure? For example, you've had some food and then you've started developing these red welts all over your body. Is there any trigger? We will note even that also. And then associated symptoms. If you have urticaria along with fever or joint pains, it might depict that there is systemic involvement. As well as genetic history. If your father or mother are allergic to some kind of food or some kind of insects or pollens, then there is a chance that you will also have that allergy trigger. Coming to the lab tests. Of course, there are a lot of lab tests for urticaria, but it depends on the pattern, onset, and how your urticaria has been developed. First is your CBC or complete blood count. See, in your complete blood count, if it is acute urticaria, you will have raised neutrophils. If it is chronic, you will have raised lymphocytes. So, based on the inflammation duration, we can see by CBC what kind of urticaria it is. ESR. ESR is erythrocyte sedimentation rate, where it will tell you if you have any sort of infection in your body, and that is why you're developing urticaria as a secondary symptom. Remember, it can present as a secondary symptom with a deep underlying cause. Then we have CRP, which is C-reactive protein, which can also tell you about the inflammatory condition in your body. And then LFT and RFT, which is liver function test and renal function test. If there is any hepatitis condition like hepatitis A, B, or C, or if you have any renal problem like renal failure, acute or chronic, it can present starting with urticaria, or urticaria can begin in the middle of the disease as well. So by knowing these levels, we will know if it has a deeper cause or if it is the primary presentation. Next, TSH. Even in thyroid, like hypothyroid or Hashimoto's thyroiditis, you can see urticaria presentation. And then ANE, anti-nuclear antibodies and rheumatoid factor. These two contribute for the autoimmune part of urticaria. For example, you're suffering with systemic lupus erythematosus or SLE, or if you're suffering from rheumatoid arthritis, many people just think it is about the joints. But remember, rheumatoid arthritis can also have a secondary feature called as urticaria, a skin presentation. And even raised ANA and RF can indicate collagen vascular diseases as well. IgE, C3, C4 and CH5. The total IgE level will tell you if you are having an allergic reaction in your body. And then C3, C4 and CH5, which is complement system, which is also a part of inflammation, will tell you if there is inflammation in your body or not. So these are the lab tests which are needed for urticaria. Next, another test which we can do in our clinic is SPT or skin prick test. For example, we have taken your case and we have noted what are the allergic reactions you are having after certain things. For example, it can be food, it can be insect bites, or it can be any other things, like for example, drugs. We will take a part of that or a part of the allergic reaction you're having due to a certain food. We will place it on the back of your body. We will put a drop of it and then we will prick the skin with it. See, this is how a skin prick test is done. These are the assumed allergens. So one drop of each allergen is put, and on top of that we will prick it with a needle, and then we will wait for about 12 to 30 minutes. And if they have raised welts near that area, it means they are allergic to that kind of allergen. And then we have specific IgE test. So what is specific IgE? IgE can be measured in two levels. One is total and one is specific. If there is total rise, it will tell you that you're having an allergic reaction, but the specific IgE test will tell you what sort of allergen you're allergic to. Next is oral food challenge, especially in countries like India. If there is any allergic reaction to food, then it can be because of fish or prawns. Or if you're going abroad like USA or UK, they might be having allergy to peanuts or shellfish. So to know what kind of food you're allergic to, the patient under the supervision of doctor is sat down. They are given a smaller amount of food of each kind and the reaction is noted. So if because we are giving very smaller amounts, the allergy reaction will be also very minor and the reaction will be noted and we'll know what sort of food you are being allergic to so that we can prevent the trigger. Next, other tests, infection screening. For example, in your routine test, you're having some sort of problem in your SGOT or SGPT levels in your LFT, or you're having some increase or decrease in your BUN or creatinine levels in your renal function test, then we can do some deeper tests to know the liver function or the kidney function or overall body function through infection screening. And also we can screen for H. pylori or hepatitis B, C or A. Cold stimulation. Remember that even physical triggers can cause urticaria. For example, cold can also cause urticaria. So we can do cold stimulation test where the person is exposed to cold and we will see if they have an allergic reaction to the physical trigger. The same goes with the heat challenge where the person is exposed to sunlight or to steam to see the allergy reaction of the person. And then what is dermatographism? As you can see in this picture, this is called as dermatographism. The clinician or the doctor will take a tongue depressor and they will start to write or draw a pattern on your skin. And after 5 to 10 minutes, whatever pattern has been drawn on your skin will represent as a raised wheal or a raised welt. As you can see, they have drawn a pattern and you can see raised skin all over the surface due to allergic reaction. If they are positive for this, then that they are called as positive for dermatographism or positive for urticaria. And then drug provocation test. There are some people who are allergic to certain kinds of drugs. So those drugs are given under the clinician or under the supervision of a doctor and they will see if they are allergic to it or not. But the doses are very milder. And then skin biopsy. For example, if you're having urticaria for more than 24 hours and also you're suffering from fever and the urticaria is very painful, then you need a skin biopsy to know what is the underlying cause. Now we'll talk about the structure and function or anatomy and physiology of this urticarial part. As you can see, your blood contains certain cells called as mast cells. Okay, so these mast cells have some pigments or some granules inside of them, and they have this IgE also roaming inside your blood. And remember that skin is made up of three layers: epidermis layer, and your dermis layer, and your hypodermis layer. Okay, so whenever there is an allergic reaction, it does not happen in the epidermis because there is no direct blood supply. So it happens in the dermis where there are blood vessels. Okay, now we'll talk about the causes and risk factors for this urticaria. Primary. Remember, if the urticaria is less than or equal to 6 weeks, then that is called as acute urticaria. If the urticaria is more than 6 weeks, then it is called as chronic urticaria. There are some triggers or causes which can start in acute form and they can make the urticaria progress into the chronic form. For example, this allergic reaction can be present in acute as well as in chronic urticaria. See, allergic reaction to either food or any certain insect bites can start in the acute form and they can go into the chronic form as well. Same with certain infections. For example, if you're suffering from hepatitis A or hepatitis B or C, it can start in the acute form even though if the systemic disease has been dealt with or has been cured, the urticaria can progress into chronic type for certain period of time. Physical triggers, either cold, heat, pressure, vibration, these can start as acute urticaria and can also or progress into chronic urticarias. Do you know that even stress or emotion can cause urticaria? A lot of people have experienced this and don't know what is the underlying pathology. When you're under a lot of stress or you're having exceptional emotion towards certain things, your skin or your hormones, there is certain imbalance in them which can cause irritation in your skin, causing hives, especially if you're having stress hives or emotional hives. You can see it on your cheeks where you're blushing or flushing, and also you will have small welts forming, which is usually acute. But if you're under stress for a longer period of time, then it can progress into chronic. And then contact irritation, this is something that needs to be dealt because it is an acute form. For example, you are wearing some clothes which are not cotton, like for example wool, or you're wearing something which is rayon, and you are very irritated or skin is irritated by it. As soon as you wear those clothes, you feel irritated, you will have these red welts, and as soon as you remove those clothes and change into something very breathable, then you will not have any reaction. Remember, natural form of clothes might not cause a lot of reaction. For example, cotton will cause reaction only in people who are hypersensitive, but synthetic clothes can cause a hyperreaction in many people. If you're choosing a dress for yourself, make sure it is in the natural form. Next, autoimmune diseases. Diseases like rheumatoid arthritis, collagen vascular diseases, or even SLE can have their systemic manifestations, and also they can have manifestations like urticaria, which is present on your body. This has to be dealt internally because there is some systemic problem where your body is affecting your own body cells and causing this reaction. Cancers. Certain cancers can also present with urticaria, and then idiopathic. Remember, even though we have lots of causes and lots of risk factors, even though we have run through 1,000 tests, sometimes you never know what is causing that reaction. As you can see in the picture, this is the severe form of acute urticaria where the person is not even able to see, her eyes are closed and the face is puffy, the skin is swollen. It can also be acute or acute exacerbation of a chronic state. Okay, and this is a usual presentation of urticaria where there is red raised welts. Okay, but this is the most severe form of urticaria. What are the body changes? Let us dive into what changes happen in our body during urticaria. Remember, as I already told you in the structure and function part, that nothing happens in the epidermis. It is all in the dermis, and it can be represented in the epidermal part because of the raised welts. Okay, and also remember that I told you you have flowing mast cells or you have mast cells in your body. So let's dive into the topic to know in detail the pathophysiology. This is a blood vessel, a minor capillary. Okay, and this is your Allergen. There are three types of allergic reactions happening in our body. One is IgE mediated, the other one is non-IgE mediated, the third one, the direct antigen will cause a reaction in your capillaries. So first, whenever there is an allergen entering into your body, what will happen is that this will cause the IgE, which is binded to your mast cell, to be activated. And this mast cell will release, it has some granules which will be released, and this granules will cause a reaction in your blood vessel. This is IgE mediated. The second one is where the antigen stimulates mast cell, causing degranulation. So remember, when I'm telling you this pathophysiology, we are not going in depth because it has more of a medical part. This part of pathophysiology which we are explaining here is so that everyone can understand it. So antigen is directly affecting the mast cell, where it causes the capillary reaction. The third one is when your allergen is directly having problem or directly causing a reaction in your capillary system. So first one is called IgE and mast cell mediated. Second one is called IgE independent and mast cell dependent. Third one is IgE and mast cell independent. Okay, these are the three forms of reactions you will be having in your body. So what does this do? What does this mast cell degranulation do? The mast cell, whenever it is releasing granules, it is called as degranulation. So what does this degranulation do, and what are these CH5 or C3 and C4? These are nothing but complement systems. Whenever your mast cell breaks and releases those granules, it attracts inflammatory mediators, and the complement system helps in formation of inflammation. So what is inflammation? Is that there will be some edematous reaction here, where it has increased redness, it has heat, it has water content or edematous. So this reaction is what you see on the skin. Okay, so all of these allergens will cause the mast cell to degranulate, and the degranulation will cause inflammation. What does this inflammation cause? Inflammation will represent on your skin as this red raised welts. So I think you understand the pathophysiology part. It is just an out sketch of what is happening in your body. Next, we'll dive into the conventional treatment program. See, even if you're suffering from urticaria, or if anyone is suffering from urticaria, what do we usually do? We consult a dermatologist or we consult an MD physician, where they will be giving us certain medications. For example, if you're suffering from urticaria, many people take antihistamines, which are of two types, sedating and non-sedating. Sedating is something which will cause you to sleep. Like if you're taking cetirizine, you feel like you're sleepy all day. And then non-sedating type. So what are the problems for taking antihistamine? For example, if you're taking antihistamine, you will have the sleeping effect where you will not feel like working a lot. And also you will have, in certain people, they will experience dry eyes, they will experience headache, as well as there are cases reported that an antihistamine use in certain elderly people can cause confusion. And then H2 antihistamines. So what do these cause? Taking H2 antihistamines, if the antihistamine sedating and non-sedating are not working, then they will go for H2 type, where it can cause severe gastric reflux, or they can give you acute gastritis if you are using for a longer period of time. And then corticosteroids. If you are giving steroids for urticaria, then remember corticosteroids do come with some side effects like weight gain, they can cause hair fall, and they can cause waterlogging in your body. Next, coming to leukotriene antagonists. So what do these leukotriene antagonists do? These can also have side effects like mood changes, nausea and vomiting. And then immunosuppressants. For example, if you're suffering from an autoimmune disease and there is urticaria, certain doctors can prescribe you with immunosuppressants. What happens with immunosuppressants? The allergy is, however, relaxed, or you will not be having acute exacerbation or reaction to that allergen. But what will happen is, because you're taking immunosuppressants, you will not have a normal reaction to a certain kind of bacteria or virus. So there are chances of infection. And next, coming to epinephrine. If you're taking epinephrine, then that can cause tachycardia or increased heart rate, and it can also cause mood changes and nausea. So these are some of the side effects by taking this medication. Now coming to the homeopathic part of urticaria. If you're suffering from urticaria and you're taking antihistamines or H2 antihistamines, you're taking leukotrienes or epinephrines or immunosuppressants, remember they all come with a tagline called side effects. But in homeopathy, we do not have any side effects for our medications. And also, if you're suffering from urticaria, which is of chronic cause and where the treatment needs to be internal, treating the organ as well as giving you that urticarial relief, then remember homeopathy is the best choice, where it treats your internal system holistically and also your urticaria will disappear. It is a timely action where the medication takes its root, and from the cure is from inside out, where you will have relief of your systemic symptoms as well as your skin symptoms. And also remember, in homeopathy we do not give you these many kind of medications like immunosuppressants and then you give some topical treatments and then you give some corticosteroids. It's not like that in homeopathy. If there is single person, then there is some medication which is tailor made for you and for your condition. So we have all in one medication for you. And also you will not have any sort of side effects and also non sedative medicines. For example, if you're taking an antihistamine, you will be sleepy all day. But by taking homeopathy medications, there is no such effect of having or being sleepy all day. So it has non sedative effects. And also we do not prescribe any sort of steroids for your body which will cause you to have weight gain or waterlogging condition. And also we do not give any immunosuppressants where your body's natural reaction to a certain infection is suppressed, causing you to cause or have a little bit of more infection or being prone to different kinds of infection. Here in homeopathy, we do not give you immunosuppressants, we do not give you corticosteroids or steroids, any such. We will not give you any medication that is sedative in nature. It is holistic, just made for you, where internally your cause will be treated, wherein it treats your disease from inside out. Next time, if you're suffering from urticaria or if you're suffering from an autoimmune disease where your body is hurting your own body, try homeopathy treatment, wherein it will treat you holistically and also your well being is improved from day to day. Next, coming to the precaution part. Remember that even if you are taking any kind of medication, the doctor will tell you certain precautions so that there will not be an outburst or a recurrence. Okay, so what are those? Identify and avoid triggers. For example, if you are allergic to tomatoes, try not eating tomatoes in any form. If you're allergic to nuts and seeds and you're eating a chocolate, then remember to see what are the ingredients in the back of the chocolate wrapper and see if there are no nuts and then consume it. And also, if you're allergic to certain kind of clothes which are fabrics not natural, then maybe avoiding those kind of fabrics can give you relief. See, identify and avoid the triggers. Next, lifestyle modifications. High insulin or insulin resistance or having some certain diseases like fatty liver, lifestyle modifications. If you are eating healthy and you are living a healthy life, then the outbreak or a recurrence of urticaria can be decreased. And then timely medical help. For example, you are having severe urticaria or a form of angioedema, where even your larynx part is also edematous. Many people are allergic to prawns and shellfish. If you're eating them and you start developing where your tongue is becoming flabby, it is becoming edematous, that can cause your airway to obstruct. So seek immediate help. Now coming to the consultation part, here at Fidicus we have two kinds of options. One is online consultation and offline consultation. If you're staying nearby our nearest branches, then in-person would be a good choice. Or if you're staying far away from us and you have different working zones or time zones, or if you're anywhere across the globe and you want to reach out to us, you can call or WhatsApp us on the number which is given here. We have two types of online consultations. One is audio online consultation and the next one is video online consultation. For example, you have already done a doctor consultation and you need medication. Here at Fidicus, we provide you with medication also. Your medication will be shipped directly to your home or directly to your doorstep. For example, if you're staying in India, it will take about 3 to 4 days for your medicine to reach you. If you're staying in USA, it will take about 3 to 5 days to reach you. If you're staying across anywhere in the globe, apart from USA and India, it can take about from 4 to 8 business days for your medicine to reach you. If you're suffering from urticaria and you would like to take homeopathic consultation, do call or message or WhatsApp us on this number. Why do you want to choose Fidicus Homeopathy? See, here at Fidicus, we stand tall with the highest success rates. We have almost have good success rate in all of our cases, and also transparent treatment. What do you mean by transparent treatment? Here at Fidicus, we will be discussing you with the plan of action of our treatment, and also there is no gray area in between. There's just black and white. And then the Fidicus personal care is top notch. So next time you want to take treatment, try Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.